Do you see, you work with people have you ever worked with people who had drug and alcohol addictions?
Oh, yeah, that's how I started out.
Were a lot of them bipolar, or?
There is some research on that, and there's probably a percentage of, some people say 30%. I've heard lately 50 to 60% of people with alcohol and drug problems have a mental illness, whether that's bipolar, whether it's depression, whether it's ADHD. So probably 30 to 60% do, and I don't know how many of those have bipolar. But again, if you have bipolar type 2, you would not necessarily know that because they're just fun and funny. Or as they get older, the bipolar type 2 turns into irritability and anger. So they get frustrated very easily and say mean things. So it's not going to look like mania. It's going to look like
irritability.
Very irritable.
I heard something about like depression is harder to diagnose in people who are older because they're just crankier, and like the crankiness is just something that comes with old age, or just stuff like that. So it could be something like that.
And with men also, it's harder to tell because women, we usually end up crying a lot.
Yeah.
Before I was medicated and I was in early recovery, I would not have known it myself because I just felt irritable and I cried a lot. But men, if they come into my office, I might miss the depression in the first 2 sessions because they don't look the way women do, sad, lonely, feeling bad about themselves. They might show at home irritability, and they might show some of those symptoms. And so I think it can be true with older people, but it's especially different based on the brain. And men have more dopamine as opposed to serotonin. We have more serotonin.
Right.
So that makes you cry a little bit more. And with men, they can get irritable.
Interesting.
And I'm really giving you a broad generalization. This isn't true across the board, but.
Yeah. I'm going to, you actually emailed me some questions, which is why I have you search on my computer, and I'm trying to find the questions because they're really, really good questions. So, why don't you tell us a little bit about yourself while I try to find the questions?
Okay, sure. Well, I think it's helpful for me
going.
as a therapist. What I started out with is alcohol and drug recovery. So probably within a year of getting into recovery and 12-step meetings, I became a therapist. And then it was probably 4 years after that, seeing a therapist, that they diagnosed the bipolar type 2, which made perfect sense to me. So probably in my career, my foundation is recovery, alcohol and drug recovery, and then after that it's psychiatric. So I look at the brain first when I work with people to see if there's ADD, ADHD, depression, addiction, whatever that could be. So I'll look at the brain first, and then we'll go to emotional mental trauma, because it's pretty rare if you have bipolar or addiction or a depression that you didn't have a parent or a grandparent with it. If you have a parent or a grandparent with it, then there's going to be some dysfunction in the family.
Exactly. How do you look at the brain? I was just wondering, because we're talking in my class about neuroscience and how that's really big now, and
I love it.
And I don't know, I want to know how you look at the brain.
Well, I wish I had the money to have it. If we all had, what we'll probably have years from now is everybody will have a brain scan, and it would either be a PET scan. I think it's the functional PET scan that would help us see the psychiatric issues in the brain, and then it would help us see the blood flow. So, for example, a woman having PMS, her brain looks exactly like a depressed brain.
Really?
And then PMS goes away, 5 days later, it's all gone.
All right.
So what we know now is that hormones affect the brain. Women have more serotonin receptor sites, so we get depressed more easily. Men don't have as many, so they don't get depressed as easily.
Right.
So it's fascinating to know there's about 5 parts of the brain. Now, to simplify, really simplified, there's about 5 parts of the brain that we look at. And when I started working with the brain, I said to the psychiatrist, I'd love to have my brain scanned. And he said, it doesn't matter. All you have to do is what these symptoms are. The basal ganglia is in charge of the anxiety and the panic. The neocortex is in charge of the ADHD and a little bit bipolar. So
really,
now that we know what symptoms are and what part of the brain they're related to, we can basically tell you without looking at a PET scan. Of course, it's great when you get a complicated client if you could do that.
Yeah.
Thousands of dollars, though. And the people that go to him, this doctor I interviewed with on my radio show, when they leave his office, it's $8,000. So
wow, $8,000.
So that covers all the scans, the diagnosis. And he said, Suzi, don't do it. He said, you don't need to do that. So when it's do that. Yeah,
my cousin's actually my cousin Emily is she's doing research right now where she's doing MRIs of people with schizophrenia and stuff like that. It's pretty interesting stuff.
It's fascinating. And with schizophrenia, it seems like after a few years, their brains change a little bit.
How do their brains change?
Well, it seems like they shrink. I mean, that's not a really good word, shrink, but they seem to lose some of the fluid in them, so they get a little bit smaller.
Mm-hmm.
Now, that may or may not affect the IQ, but they literally physically change. Some people say that they are different when they're born.
Right.
I tend to believe that from what I've seen with working with schizophrenics, but there's definitely a difference.
We're talking about, and I'm doing some research with Dr. Blatchley. We're doing research with rats, and we're doing what we're doing is we're looking at how stress affects them, and particularly the mom rats and how their mothering style affects the kids.
That is wonderful.
And what we were talking about is how we're talking about the HPA axis, and has something to do with cortisol.
Right.
Cortisol
right.
is something else.
Cortisol, right.
Cortisol,
right.
and how that can actually, when that HPA axis gets shut off, how that can physically change your brain.
And children raised with a lot of that sort of stress later
Right.
on, they don't mediate stress as well in their own brain. So the cortisol is different. The when you get super excited, the adrenaline is different. So which is caused by some different types of trauma, is sort of a permanent change in the brain. But, you know, my experience is they can get through it and can get a little bit better or a lot better depending.
Interesting. So you can overcome that, like if your brain has been physically changed by some sort of stress in your life, you can overcome that?
Well, my personal thought on that is just like a blind person, if you've been seeing all your life and you're blind, what happens in a couple of years as your hearing becomes more acute and
Right.
your different senses take over. So I don't think they will correct it 100%, but I think that the way that you cope will sort of make up for that a little bit. Although, you know, when I work with clients that have been really traumatized, I prefer that they get on medication in the beginning because it makes it 10 times easier for them to cope. And then their brain gets used to knowing how to manufacture the appropriate chemicals at the right
Right.
time. So then when you take them off medication, they have a better chance.
Right.
So I used to be against medication until I did all this research on the
Yeah.
brain. And now it's like, let's make it easier. And then if you want to go off of them later, go off.